Hi there, Samantha Jellison of Securely Insured, and this is Medicare on the Mind. Today I want to talk a little bit about something called value-based care. This is a somewhat newer concept that is actually starting to become more popular, especially in rural areas. Although we are seeing it in more and more cities, it's something that I'm not sure everyone is aware that it's being offered. And basically, the idea behind value-based care, these are specific health clinics that put an emphasis on treating the whole person. They are prioritizing patient outcomes versus offering more individualized services. What they're basically doing is they're providing more one-on-one time with your provider, with your doctor. They're getting to know you as a whole person, not just one specific issue or one specific ailment. I've been hearing a lot of good feedback from some of my clients based on this, and I think it's important to address because not many people are aware of it. And really, what they are doing within this model is that providers are being compensated based on the quality of their service versus the quantity. They are being compensated based on positive feedback from clients who do go to see them, the type of experiences that they're having, and it's what you would call a more collaborative approach, as they have multiple providers, doctors within the clinic setting that specialize in different areas. So rather than one doctor making their opinion based off of whatever you're coming in for, they're collaborating within the entire community of doctors available at these clinics. And there's quite a few in this area. I'm in Western North Carolina that are becoming more available to people here. A few of them that I can name off that you might want to look into. One that we have specifically in my area is known as Hopscotch, and within the city limits there is Centerwell, there is Oak Street Health. All are going to have a wide variety of Medicare plans or carriers that they accept. They're very Medicare centric. So it's not something that I endorse. I'm not there yet. I can just say from experience, my mom, who's on Medicare, she has this fantastic doctor, great doctor, although we've lovingly dubbed her Dr. Doorway because she literally will come in, barely, ask how my mom's doing, does she have any concerns, types on her computer, and out the door she goes. She's in and out within, I'd say less than 5 minutes. And my mom has a lot of health concerns. So I mentioned to her, why don't we look into this value-based care model? And wow, what a difference. They spent close to an hour with her, getting to know all of the ins and outs of her medical conditions. And they were very collaborative in asking, how do you feel comfortable in treating this? What have you tried? What haven't you tried? What are you willing to try? I was really impressed with it, and I have like I mentioned, talked to many of my clients who have just started exploring value-based care clinics, and a lot of them, if not all, have had very positive experiences. So if you are new to Medicare or even well into Medicare, this is definitely something you should think about exploring if it's available in your area. I know we all have doctors that, we love and we want to stick with, but sometimes as you're aging, you're acquiring more health concerns and you want someone to take the time to hear you and understand where you're coming from. And unfortunately, a lot of your average primary care physicians that you've been with for a long time, they are over scheduled, overworked. They're trying to see as many patients as possible. We're definitely facing hospital cutbacks and shortages. And honestly, it's not something I'd want to gamble with if I had a very extensive medical concern. So just an option for you to think about. And if you are looking into value-based care and you need a recommendation for your area, feel free to reach out. I hope this was helpful, and I hope you have a wonderful day. This is Samantha Jellison of Securely Insured, and this is Medicare on the Mind. Stay tuned for our next episode.